So today we've got two presentations. We want to give more time for questions, especially questions which were not answered during the previous days. We'll start off with Mrs. Jokonya, who will take us through cleaning and disinfection. In prior days, we did what is COVID-19, how it is spread, the signs and symptoms of COVID-19, an analysis of the situation on the ground here in Zimbabwe as well as globally. We also went through the prevention methods for COVID-19, the issue of hand hygiene, cough etiquette, the use of face masks, how to conduct public gatherings, or rather how to avoid public gatherings and how to conduct them should they be unavoidable. We also went through the issue of we also went through what is self-isolation, what is self-quarantine, as well as the issue of risk perception, which Dr. Gonese took us through. So to yesterday as well, Dr. took us through psychological support in the context of COVID-19 and also addressed issues to do with stigma. So we hope as a church, we hope as communities that the issue of stigma will be a thing of the past as we are empowered with more facts around COVID-19. So without further ado, Mrs. Jokonya, if you are ready, you can take us through. Thank you. And as always, let's make use of the chat room to put any questions there. They'll be addressed either in the chat or verbally at the end of the presentation. Thank you. Mrs. Jokonya, over to you.
Thank you, Dr. Eo. Good evening to everyone. We want to thank God for the past 5 days where we have been taught. The word of God says, my people perish because of lack of knowledge. So knowledge is key in this season. It is important for us to know what to do. The word of God also talks about the sons of Issachar who understood the times and knew what to do. So it's important for us to know what to do. We do not want to act like foolish people who do not know what to do. So we have been equipped from hand washing, use of face mask, the overview of COVID-19. And yesterday we covered, Dr. Marisa covered the issue of psychosocial support in COVID-19. So today we are looking at household cleaning and disinfection. Okay, so looking at the whole issue of infection prevention and control, the issue of personal and household hygiene is very key. So it is important to personal hygiene and household care is very key in this season. So frequent cleaning and disinfecting your home is very important. You don't have to wait until someone is infected for you to start to disinfect your home. So also the issue that about coronavirus, we heard from Dr. Chimpetete that a bigger number of people who contract the disease might actually have mild symptoms or have nothing noticeable. So you don't have to, you don't know whether infected or not unless you are tested, since some people don't even show symptoms. So it is important to take care of our loved ones, to disinfect and make sure that our environment is clean. So coronavirus make its way into our homes through unlikely pathways. When you're outside our homes, we come into contact with a lot of germs everywhere we go, as we travel in the Zupco buses, as we drive our cars, we touch different surfaces. So zvakakosha kuti tinzwisise nyaya yeutsanana nemamwe mazwi totaura kuti it's a season yekuti tiite utsanana zvakanyanyisa nekuti hatizivi zvatakabata. Also the issue yekuti the virus can also be on your clothes, it can also be anywhere pauri papo. So it is important for you to understand the issue of personal hygiene. So here I'll start to define a few terms. Cleaning, we all know cleaning. Cleaning is the removal of dirt, impurities, and germs from surfaces But cleaning does not necessarily kill germs, it just removes germs. Sanitizing lowers the number of germs on surfaces or objects. Then there's disinfection. Disinfection, are using chemicals to kill germs, which includes viruses, bacteria on surfaces or objects. Those arrows are not showing so much the order, but it's just showing that we clean first, and the next order that lowers the number of germs is sanitizing. Then the highest one that actually kills is disinfection. So looking at cleaning, when we are talking about cleaning the household, cleaning is the first step of a complete process and cannot be skipped, meaning you cannot start by disinfecting without cleaning. So cleaning followed by disinfection is the best practice for prevention of COVID-19. Should always clean surfaces such as floors, windows, tables, bathrooms, toilets with soap and a detergent such as Endi if available. But the best is make sure that we clean our surfaces using soap and water. Always use a clean cloth and or mop for cleaning if available. So yeah, when I was talking about a clean cloth, I was just thinking, kuti zvikorobo zvatinokorobhesa pasi zviya, sometimes chinenge chasviba chachinja color is not good, especially this season. We have to make sure that we clean zvikorobo zvedu zvinogona kuwachwa zvichichena, so that we make sure that we are minimizing the issue of infection. So because we can also mop iyoyo tikasaigeza inokwanisa kutova a source transfer infection from one place to another. So it's always important that when after cleaning we make sure kuti zvikorobho zvatinoshandisa, mop yatinenge tashandisa, it's cleaned and even disinfected, so that it will not carry infections from one place to another. So when disinfection, we are talking about what do we use? We are talking here about using ordinary jik, which is readily available and affordable. That is jik yatinowana mashops here. Jik yekuti in this season, it's actually encouraged kuti in every household tiwane bhodhoro rejik. Normally inowanikwa iri ma 750, ma 1 liter, ma 2 liters, but it's better to buy something than kuti tibva tatoshaya zvachose. Have something to use as a disinfectant. So jik in this season, it's a must to have a bottle of jik in your home, so that you can use it for disinfection. Are we together? Can you still hear me?
Yes, loud and clear.
Thank you. So here we are going to talk about preparing your disinfectant, that is jik. There apo ndangoisa picture pakanyorwa that sodium hypochlorite 3.5%, that is the strength yejik yatinowana mashops. Inogona kuwanikwa iri different strengths, but kazhinji kacho inenge yakazi 3.5, which means that's the concentration yejik yatinowana. Iyo syringe iyo ndanga ndichimeasure the amount of jik yatinoda. On the right side, to make 0.1%. 0.1% is the strength that we need for disinfection in the home. We don't need to pour a lot of jik in your bucket. Normally, kazhinji vanhu vanongovhura chibhodhoro chejik kwakutongodururira mvura. So in that case, you will actually be wasting. 0.1% is the recommended concentration of jik. So we are saying, assuming we want to make 500 mils of a disinfectant, we are saying in that formula 0.1 yatiri kuda kugadzira isusu concentration yatiri kuda, divided by 3.5, which is jik concentration yedu yejik, to multiply by 500 ndokuwana kwatakaita 14 mils. But in that case, you don't need to kuti murambe muchingoweka muchimultiply. Apa tangoisira for the sake of those who really want to calculate. But we are saying in simple terms, you take 14 mils jik, that is 14 mils jik, wodziisa muchibhodhoro chi 500 mils kana kuti shedring or something, in case you want to measure. So you put 14 mils jik and top up nemvura to make 500 mils. Saka 14 mils jik basically is zvivharo 2 zvejik chigaba chi 750 chejik chiya zvivharo 2 izvozvo ndo 14 mils. Saka tiri kuti tinodira zvivharo zviri muchibhodhoro che500 ml, then we top up with water. So inobva yatipa concentration atiri kuda ye0.1%, which means that one is it's enough for disinfecting your home. So basically, what we are saying is that that concentration atinenge tagadzira iyo, it's actually recommended that you do it daily, because when you leave it for a number of days, it loses its potency, it loses its concentration. So atigori kuti tobva tagadzira yesvondo rese. That's why takashandisa 500 ml. It's easier kutigadzira tigadzire iri shoma rather than kugadzira yakawanda, unless kanoda disinfect away big place. But it's advised, it's recommended to make that solution daily so that it remains iri potent kana kuti ichishanda zvatinenge tinyatsoda kuti ishande. So that's preparing your own disinfectant tichishandisa jik, zvivharo zviri zvejik tozviisa muchi500 ml chiya chemvura is better. It's easier in the kekutanga kana tisina chekumezhesa tongoshandisa zvibhodhoro zvinenge zvakapera drink tonyatsochigeza toisa 14 ml dzejik, then we add water chobva chazara, inenge yatipa the required amount yatiri kuda. Kana makuda kupita more munoenda muchingomultiply according to the level of water yatinenge tinayo. Then moving on, the disinfection, we are saying you have to disinfect all high-touch surfaces and areas daily. You have to do it daily. Here, when we're talking about high-touch surfaces, we are saying door handles. Everyone achipinda mumba anotovhura door. Kazhinji munhu anotobata door handle. We are talking about light switches. Panobatwa every day. Pachidzimwa pachitwa on. Fridge handles. Panobatwa every day. Pachivhurwa fridge ichivharwa. The issue of remote control. Inobatwa kakawanda newana. The toilet and the bathroom. These surfaces are high-touch surfaces. It's including many other, and you have to use a proper and recommended disinfectant like sodium hypochlorite for disinfection. Like I said, we are encouraging every household to have chibhodhoro chejik chinofanirwa kuti chigara nayo. So like I said in the previous slide, that 0.1% is ideal for disinfection of households in the context of COVID-19. So it's chibhodhoro chakabatwa pa picture icho ku downtown uko zviriko, and you can get them for $1. You can get them at less price. Chiri easier kushandisa spray bottle icho, because unokumeasure mvura yako imomo, then kwakungo spray pama surfaces, then you leave for about 10 minutes or so before wiping with a clean cloth, like what is being demonstrated in the picture. Chibhodhoro ichocho tinogona kuchitsvaga chiri chinogona kuwanikwa. Kana tachishaya zvisinei, you can still use whatever we have to clean my surfaces. So that slide from CDC, it's just emphasizing the key times to clean and disinfect your home. What I was saying, the high-touch surfaces. Also, if someone is sick in the home, you need to clean after they touch additional surfaces that anyone else in the home might touch. Then use for cleaning is emphasizing the use of soap and water. It's also emphasizing the application of a disinfectant there. So in the next slide, I'm talking about caring for a sick person in the home. Say we have got someone who has tested COVID positive. Either they have symptoms or they don't have symptoms. They're still infectious even if they don't have symptoms. So when we are caring for someone who has COVID, who has the virus in the home, we need to take extra precautions to clean and disinfect the house. You need to disinfect surfaces frequently and when necessary. When necessary, here I'm saying, you are saying maybe the sick person or the person has got COVID, maybe you've disinfected, but maybe they touch a certain surface, you still need to disinfect. So you need to disinfect surfaces frequently when you've got someone who's got COVID in the home. You need to avoid sharing utensils if it's possible. Just make sure that they're using their own utensils. It helps to minimize the risk of infection in case we don't clean them thoroughly. So it's advisable to have them use their own utensils. Need to clean and disinfect those utensils after use. Make sure that you clean them thoroughly with soap and water, and you disinfect them after they've used them. You need to keep the house and any shared space well ventilated with good airflow. The issue of opening windows, make sure there's good airflow in the home. So when you are caring for someone, like I said, it's extra precautions need to be taken in order to avoid infecting the whole household. Because we have noticed that mostly the COVID, you actually get the infection from someone who's close to you. So we need to make sure that if it's a parent, even if it's a child, they're using their own room if it's possible, and that room is also kept with a well ventilated. You need to use masks, continue the use of masks. In the previous presentations, it was shared that you need to always have a mask when you've got someone in isolation. When you've got someone who is positive, you need to put on the face mask. Then in the household, there's also something that the issue of masks, like when you're coming from outside, whether it's a cloth mask or it's a surgical mask, we need to make sure that we dispose of those properly. If you take your mask and you put it on anywhere on top of any surface, what you're actually doing, if there are viruses there, you're actually transferring the viruses to those surfaces. So it's better when you're using your cloth mask, when you're coming from outside, make sure as soon as you come into the house, you put your mask somewhere in a bucket where there's soap and water, then you clean it. It's a small thing. It doesn't take you 5 minutes to wash it. Then you make sure that you are using it tomorrow and it's clean, rather than having the same mask for the whole week. We have seen my mask anenga chinja color, brown from white. Then what you are simply doing is you are not protecting yourself, because mask yo inenge yani trina. So it's also one issue kuti tingwarire in the home. Also, kana tiri kubva panze, tiri kubva kwatiri kubva and coming into the home, it's always good. It's better to have a sanitizer panze, kana paine veranda or somewhere pamunokwanisa kuisa sanitizer, so that munhu asati apinda mumba, kana vari mavisitors wenyu, tell them to sanitize vasati vapinda mumba. Even imimi uchipinda mumba, usati wapinda mumba, sanitize your hands before wavhura madoo kana kutambirwa newana or any of those things. Make sure that you sanitize your hands. Kana pasina sanitizer, make sure kuti pane mabhaketi anogadzirwa nevanhu aya aneswa tape, then munokwanisa kungoisa sipo mukati, then make sure kuti munhu usati wapinda mumba wageza maoko. So zvakatikoshera izvozvo kuitira utsanana, kuitira kuti tisarambe tichiparadzira kutapukira kweutachiona COVID-19. So I thought I could just share those issues, those tips on making sure that we are taking precautions in COVID-19. Also, issue yekuti for some people like us, when we are coming from work where there is high risk, the first thing is to bath, totobvisa hembe tokanda uko, kwete kuti ndabasa neuniform like some of us, obva wagara nayo mototandara, and you know what you are simply doing is spreading the germs kana aripo to the lounge and everywhere else. So we need to make sure that we take extra precautions. Nyaya yeutsanana yakakosha, kugeza maoko, because tiri kutaurirwa kuti prevention. So kugeza maoko kwakakosha, and also kugeza maoko ikoko, we have to encourage each other. Chingotsurana, I remember coming from one place, it was a funeral. Then one of my aunts wanga vari kugeza maoko, but vakageza roko one. You know, there are people vane this vajaira kuti kana ari kunzi geza maoko anongogeza roko one, kungogeza tuguma kudai so. Then you know, tinoda kuti tirambe tichichenjedzana kuti noka nyangwe muri kunzwa kuti hamuna zvamabata, maoko ngaangogezwa aperi. Dai aipera ndofunga imanesi nemachiremba angadai maybe now ameno zvaangadai aita ngati encourage ani ngatigeze maoko kunyange usiri kuona tsvina maoko ngatigeze before touching anything. So ndichipedzesa, I was enjoying the book of Leviticus this whole week, and I said Mwari vanoshamisa ndo zvinonzi neshoko na we saved everything that we need. Chese chatinoda chirimo mushoko. Leviticus anotaura panyaya yekuti how do we, anyone an infection disease, what should you do? Leviticus 15 verse 4 to 11. Hence every bed on which the one with the discharge lies shall be unclean, and everything on which he sits shall be unclean. Anyone who touches his bed shall wash his clothes and bath himself in water and be unclean till evening. Anyone who sits on anything on which one with a discharge is set shall wash his clothes and bath himself in water. Anyone who touches the body of the one with a discharge shall wash his clothes. And anyone with a discharge, if anyone with a discharge spits on someone, and ndopai patinotaura nyaya yekuhetsura tumvura tuya tuchienda, when that happens to someone who is clean, then he shall wash his clothes and bath himself with water. And anyone with the discharge touches without having rinsed his hands in water, they shall wash their clothes and bath in themselves in water and be unclean till evening. Now, I'm saying to this portion of scripture, Leviticus from chapter 14 and chapter 15, and says, dzinotaura nyaya yekuti anenge aine infectious disease chabata chese paagoma kumberi kwacho kunotaura kuti hanzi kana dai hari chaiyo yaanenge abata, anything chaanenge abata shall be unclean, and whoever get in contact with that thing shall bath and wash their clothes in water. So this is what we are saying, which even when we have got someone who has got COVID, tiri kutaura ndo nyaya isolation iyoyi, kuti kana paine munhu chaabata, kana paine chaita in contact with anyone anenge azobatawo shall wash their hands clean and make sure that they are maintaining the issue of infection control. So shoko raMwari riri kutidzidzisa ipapa kuna Leviticus nyaya yekuti tidzivirire zvirwere zvinogona kutapukirana. So I think yes, so that is what I had in brief to share with you in terms of household disinfection and cleaning, and also in brief how to take care of someone who has got COVID-19. Thank you. Over to you, Dr. Yeo, or Dr. Magumi said the chair.
Thank you, Mrs. Jokonya, for taking us through. I think some of these things we take them for granted, and yet we have learned quite a lot. Please keep the questions coming through the chat room. We will address them after the next presenter. Dr. Chimbetete, if you are ready, you may proceed.
Thank you very much, Dr. Yeu, and thank you very much, Mrs. Jokonya. My simple task today is just to take us through the treatment of COVID-19. Ndakwanisa kushare slide screen yangu anditi?
Yes, just put it on PowerPoint mode. Slideshow mode.
It is on slideshow.
Saka, it's Mrs. Jokonya's slides right now.
Okay.
So what do I do?
Mrs. Jokonya should stop sharing.
Yeah, she needs to stop sharing.
Yeah.
Thanks. That's good. Yeah.
Okay, can I share right? Okay.
Excellent.
Ripa slideshow. Can you see?
Yes, we can.
Yes, we can.
Yeah, thank you. Magadi Amazon.
Magadio.
Tinofara. So today I'm just going to briefly talk about treatment of COVID-19. I think most of the issues we have been raising them during the week as we were discussing. but we thought it was just important to emphasize a few principles around the treatment of COVID-19. I think Dr. Marwisa said it very well. Kubata COVID-19 has got nothing to do with moral failure. And Fundis Vengesai emphasized to us Kubata COVID-19 has got nothing to do with our faith. So if we get, of which some of us will get, COVID-19, how are we supposed to, what's supposed to be happen? So Chekutanga, let's make it very clear that to date, as we speak today, I think today is the 8th of August 2020. There is no specific vaccine, neither is there any specific medicine for COVID-19. Zvinabasa kuti uri kuAtlanta, Georgia, zvinabasa kuti uri kumahosekwa, zvinabasa kuti uri kuMexico, hakuna mushonga uri specific kuti uyu mushonga uyu ndiwo unorapa COVID-19. Zvasiyana nemalaria yekuti unyasoziva kuti specifically munhu ane malaria ndinomupa quinine yemalaria. Saka hakuna mushonga weCOVID-19. But scientists all over the world are continuing to investigate. Researches are being done, work is being done in the lab to try and come up with specific treatment for COVID-19, to try and come up with the specific vaccine for COVID-19. But to date, ashazvaitika izvozvo. Saka mukanzwa munhu achitaura nyaya yekuti ndine mushonga wekurapa COVID-19 kana kuti this herb kana kuti chii, zivai kuti manyepo, because hakuna mushonga, whether a herb or a medicine, that has been proven to treat COVID-19. So in this era, nguva yatikurarama yeCOVID-19, if you start feeling sick with some of the symptoms that we have discussed, or some symptoms that you don't understand, what should you do? The first thing that you do, you must have, I think the first thing that you do, if you start feeling sick and you can't understand, as early as you can, please get tested for COVID-19, and takashitaura kuti testing yacho ngaive PCR, because the sooner you know kuti uri infected, the better in terms of how you can be helped. Try and get as much rest as you can, take lots of fluids, and eat nutritious food. So in other words, what I'm just saying is COVID-19 or no COVID-19, let's live healthy lifestyles. And healthy lifestyles means you get adequate rest, you get adequate fluids, you eat well, you exercise and all that. So this is all part of of healthy lifestyle. And it's also important in the context of COVID-19 infection. I think Mrs. Jokonya has done a good job telling us that try and once you are confirmed to have COVID-19, try and protect the rest of the family. So if you can stay in a separate room, the better. If facilities are permit pambapenyu, you can have a bathroom to yourself, the better. If you can't, then just use all the precautions that is square, wear a mask, disinfect, clean, sanitize. And whilst, because the majority of us are going to have mild or moderate illness, let's try as much as we can to stay active, try as much as you can to maintain contact with loved ones through the phone or internet. I think there's mental health. Like I emphasize, if we get infected, we let other people know. So you can let somebody know either by WhatsApp, you can phone a friend, you can phone your pastor, you can phone a cell group leader, what test positive and COVID-19, so that people can constantly check on you if you are at home. Then in terms of the actual medical management, we know patients can either be managed at home or they can be managed in hospital. And this depends on the severity of the symptoms. I think most of us on this call are not medical. So one thing that I need to emphasize, we shouldn't on our own judge whether this is, I'll be managed at home or I'll be managed in the hospital. I think it's kosher that we get medical assessment, be it via the phone or physically, but somebody to assess us and then tell us, okay, stay at home and let's continue in touch. So if you are having difficulties in breathing, then you have to be in hospital. And in hospital, what's key in hospital, people, banachiremba makoti, they will measure what is called your oxygen saturation. And the important gas there is oxygen, which is then carried to the rest of our body via our blood. So we measure the amount of oxygen in your blood, and we want it to be above 95%. That's where it usually is, 95% and above. Once it gets to below 93%, some will say 90%. Once it gets below those levels, then you need to be assisted in terms of oxygen. You have to be in hospital. Make sure other causes of fever and shortness of breath have been excluded. I think it's really important to emphasize and mumwaka uno we-COVID-19 hazvirevi kuti zvimwe zvirwere zvese zvambotora holiday. Hazvirevi kuti urwere hwese huchaitika iko zvino i-COVID-19. Saka what we don't want is kuti munhu anodevelopa malaria and then we miss the malaria because focus on COVID-19. Kana kuti munhu anodevelopa problem yemoyo and agara neproblem yemoyo and akuzarirwa nekuti mwoyo wake hausipamba zvakanaka, and we miss that and think that it's COVID-19. Kana kuti munhu anodevelopa mabayo because vanhu vagara vachiita mabayo. Somebody can develop a bacterial pneumonia and we miss that thinking it is COVID-19. So it's always important, it's very important that other causes of illness are excluded before we just say it is COVID-19. So in terms of treatment, please do not self-medicate, because what's happening, there's a lot of information on WhatsApp, there's a lot of information on social media, and yeah, I've seen people who are self-medicating. You can actually harm yourself. So for the medical people on the call, I've met people on a COVID-19, ndatotanga aspirin, ndatotanga prednisolone, ndatotanga chini. And then you say, no, you know what? These things must be started by a registered medical practitioner. Otherwise, you may actually harm yourself. So please, if you get infected, don't self-medicate. Musawering treatment in my newspaper, musawering treatment by WhatsApp, musawering treatment by Facebook. Seek for medical attention, a qualified medical practitioner to help you. So generally, people are given antibiotics, not because antibiotics treat COVID-19, but because usually when somebody has got respiratory symptoms, or a fever, we may not be able to exclude bacterial infection. So because we are not able to confidently say hauna bacterial infection, it then makes sense to treat you for bacterial infection just in case. Then paracetamol is given. Paracetamol lowers the temperature because one of the main sign or symptom of COVID-19 is fever. Paracetamol lowers the temperature, and also paracetamol is an analgesic. So with an analgesia, it helps with the headache, it helps with the muscle pain and all that. And then dexamethasone. So I know there's a lot of talk about dexamethasone. People then celebrated, no, dexamethasone, mushonga wawanikwa, COVID yakurapika. Dexamethasone does not treat COVID-19. Like I said before, hakuna mushonga uri specific against COVID-19. But what studies have shown us that dexamethasone has helped and has shown better improvement among patients with severe cases. So dexamethasone is recommended only for those people with severe cases of COVID-19. Mild cases of COVID-19, you do not need to go on to dexamethasone. So dexamethasone has been shown to improve survival, but specifically in hospitalized cases, in severe cases. Then oxygen therapy in severe disease. I think it's important that vanhu vasanonokerwe kupiwa oxygen, because vakanonokerwa kupiwa oxygen ndo zvinozoita kuti deteriorate. So what's important is if you feel good, you are struggling to breathe, if you feel excessively tired, please seek medical attention. When you seek medical attention, whoever is looking after you, make sure they check how is your oxygen concentration. Do you need additional oxygen? If your oxygen concentration is now below 90, make sure you get oxygen. So I know people are going to ask, but oxygen yacho. What's important is to to go to the hospital early. It's always better to go to the hospital before things become urgent, or you want to go to the hospital before it becomes an emergency. Because ukazo deteriorate at 3 a.m. to then get you admitted at 3, it becomes a challenge. So it's better to go to the hospital, or it's better to shout out for help, and then you are monitored, so that before things deteriorate, if the healthcare practitioner suspects that you could need oxygen, we start making those arrangements, which are okay. So recently I found out there's actually now, for those who are in Harare, there are actually facilities to get oxygen cylinders in your home. So there are companies, I know one company known as Utano, they'll bring an oxygen cylinder to your house with the devices to deliver oxygen. They will show you how it is done, so that when you feel good, you're not feeling well, if resources permit, you can get this small gadget, the pulse oximeter. We recently bought some at our workplace. I think they're costing around $30 in town for those that can afford. You get a pulse oximeter at home. It's a very small device. You just put it on your finger. It tells you the oxygen concentration in your blood. If it's now low, you've got a cylinder at home. You start giving yourself oxygen. I know of patients who have been doing that in the past week, and it has gone on very well. Ugare uchiti zvaita better, and then things deteriorate. And then there's been a lot of talk around hydroxychloroquine or chloroquine. I know people have become emotional about this. Today I saw somebody with COVID-19, and they started themselves on hydroxychloroquine. Let me be very clear on this one. So I just took a paragraph from a medical journal, up to date. So we suggest not using hydroxychloroquine or chloroquine in hospitalized patients, given the lack of clear benefit and potential toxicity. In June 2020, the United States FDA revoked its emergency use authorization for these agents in patients with severe COVID-19, noting that the known and potential benefits of chloroquine no longer outweighed the known and potential risks, i.e. chloroquine or hydroxychloroquine. There is nowhere in the world where it is licensed for the use of treatment for COVID-19. Clinical trials studies have shown that the potential benefits are way outweighed by the risks of chloroquine. So you may actually harm yourself by taking hydroxychloroquine. It doesn't work, and it has got potential toxicities. So in simple, I'm saying let's not use hydroxychloroquine. Let's not be emotional. I know there was a clip, an American doctor who was talking, I've treated people with hydroxychloroquine. In medical science, we do not rely on opinions of one person, because there are a lot of factors that can affect. I mean, the majority of people with COVID-19 have got mild disease and they will recover. So if you give them chloroquine, recover, can we then say chloroquine recover? So proper studies have to be done. And so far, the proper studies that have been done have shown that chloroquine is not beneficial. Then there are some myths around COVID-19. Because we are saying you use alcohol sanitizers to clean yourself in the communities, COVID-19, you should drink sanitizer, it will cure the infection. You risk poisoning yourself. Kunwa sanitizer does not cure COVID-19, does not help. Because we are saying 70% alcohol, batsira kuuraya COVID-19, some people then think kuti ndikamwa kachasu, ndikamwa bronco, zvinobatsira kuuraya COVID-19. This is what people are telling each other in the community. That is a lie. It does not work. Some people are telling each other, no, heat inouraya COVID-19. So if you feel you've got COVID-19 and daundomira pazuva for a long period, it will kill the virus. That is a lie. What you need to do is contact the health sector and get help. What about ginger, garlic, lemon juice? Some people are saying that if you take that, they will eradicate the virus. We know that ginger, garlic, and lemon juice have got health benefits. If you take lots of fluids, lemon, vitamin C, citrus, and all that, yes, they have got benefits. But these benefits are not specific against COVID-19. So it's not entirely true that lemon juice inorapa COVID-19. Like I said before, there is nothing specific chatoziva chinorapa COVID-19. But it's okay to take lemon juice. It's okay to take oranges. It's okay to take lots of fluids. It's okay to take antibiotics. It's okay to take dexamethasone. It's okay to take paracetamol. All these are helping your body to win the war against COVID-19, but they don't cure COVID-19. So in summary, what have I said? If you suspect that you've got COVID-19, early testing, PCR testing to confirm infection is key. Get medical assessment as early as possible, either physically or by phone, but talk to a qualified health practitioner. Make sure your household members are safe. If they're mild cases, you can manage at home and constantly get somebody medical to be checking on you. If it's severe cases, the earlier you get into hospital, the better. And please, please do not self-medicate. Do not look after yourself. Allow somebody qualified to look after you. Good, I'll end there and then we can move into the discussion. Thank you, Dr. Yeo.
Thanks, Dr. Chimbetete, for that comprehensive presentation. We are open for questions. If you've got questions, please keep them coming in the chat room. Or you can also speak if it will take long for you to put your questions in the chat room. We will address both questions from the two presentations, the first one from Mrs. Jokonya and the second one from Dr. Chimbetete, as well as any other questions which might not have been addressed during this week. I will repeat some questions which might have been answered in the chat room for the purpose of everyone. Okay, so that everyone understands. One question was, so are you saying over and above using handy on the floors, we should use jig too? Mrs. Jokonya, are you on the line? Someone is asking, in addition to using handy, should we use jig too?
Yeah, okay, doctor. So we are saying handy is it's just a cleaning agent, but when we want to disinfect, we have to use jig. So you can actually use a disinfectant on the floors. So you can actually, instead of just using soap and water, you can also add jig when you are disinfecting. But when we don't add jig, tine sipo chete tiri kungoita cleaning. So kana tiri kuda kuita disinfecting, ndo patinoisa jig. So we may not be able to use the jig permafloors every day, depending on availability. But kana takuchengetera for disinfecting my high-touch surfaces, ndo patinogona kushandisa jig. But when it's available and you really want to make sure that your floors are clean, you can add or domestos.
Thanks, Mrs. Jokonya. If my maths is correct, the 350 mils of jig should last 18 days, 8 days, if we are using about 500 mils a day. So yes, jig is affordable if it is used properly. So that's just a take-home point there. And someone was asking about the use of domestos in place of jig. Mrs. Jokonya again, or anyone from the team.
Yeah, but when we are really kanatakuda disinfect like my high-touch surfaces, we have to check now concentration sodium hypochlorite irimu domestos. Is it really enough for disinfection? Unfortunately, I don't have a domestos to check the concentration, but especially kanatakuda kuita disinfect my high-touch surfaces, I think advisable.
Thanks, Mrs. Jokonya. So from what I hear, There's Joseph whose hand is lifted. If it's not with regards to this, we'll let you speak just now. So from your presentation, Mrs. Jokonya, the understanding is 0.1% hypochlorite is what's ideal in the context of COVID-19 for disinfection. So you're basically saying chlorine-based disinfectants are ideal. So from your points there, what the person should look at is the concentration of chlorine in the disinfectant you're talking about, be it in Domestos. Okay, I'm trying to read what Domestos says. Also, it's Domestos, the one I'm holding is written 3% chlorine. So it means your calculations are then affected by that 3%. You use the same calculation Mrs. Chokonya has given us, but she had put 3.5%, you then put 3% to get the amount of water you're going to add. Mr. Joseph, you may go ahead.
Yes, thank you very much. Thank you, Dr. Chimbetete, for the wonderful presentation, although I joined a bit late. I want to ask about disinfecting. Are there any disinfectants that can disinfect the air? Like you enter a room and you suspect somebody might have infected the air inside the room. Are there any disinfectants that you can spray, like Doom and other things that you can spray in a room?
Thank you, Joseph. Anyone to answer that question? Okay, what we do understand is that when companies, let's say the notices which are coming from companies these days, when they say we are fumigating or we are fogging the premises because we've had a positive case of COVID, yes, they'll be mostly using a mist form of a disinfectant. But these are not recommended for home use, because what we do know, even when companies do these processes, they ensure there's no one at the premises when the processes are being done, and they give you a stipulated number of hours before which it is unsafe to re-enter the premises, because we know some of them are poison. Some of those substances can be someone inhales them. So for home use, that might not be recommended. Dr. Shingi, you want to speak into that?
Yeah, I was just going to say, the only real way that they use it's more for like medical facilities, something they call negative pressure rooms, which basically suck out the air of a room and ensure the air keeps cycling continuously, so fresh air keeps coming in. But in terms of home or office environment, there isn't really. The most important thing is to ensure good ventilation, right? My windows are avurika. If you can keep your doors open, keep them open, so that air is continually moving through the house and through the rooms, because that keeps that reduces the risk of or infected air chingoramba iri muroom. So yeah, so there's no way to disinfect per se, but good ventilation, even kuma hospital. Not all the wards need negative pressure. Sometimes, like even Kupar, just keeping those windows and the doors open, the corridors open, air moving. My healthcare workers are COVID patients are actually getting less infections than the sisters in the other side. But if you do suspect a COVID patient, you should wear a mask. Or if you are home nursing a COVID patient, then you need a mask, preferably not a cloth one, but either the surgical or the N95. So I hope that answers your question.
Okay, so how long does it stay in the air when let's say you've got some people who have come to work at your house and they are working in your bedroom? Before you begin to use it, how long you open all the windows? How long does it stay in the air?
Okay, so there's two levels of what can I say, air contamination. Palatonotima droplets, and it that can just come out with loud talking, etc. So iwo ndo atinoitira social physical distancing, because as they leave someone's mouth, they fall to the ground within 1 to 1.5 meters, and they don't remain in the air. So that's the normal. But kana munhu achikosora or asiniza in the room, then you can generate what we call aerosols. Those are smaller droplets, gonna hang around in the atmosphere. But if you are getting a good flow of air, the windows are open, the doors are open. I can't really give you an exact figure, but I can say, Susu, in let's say in theater, we need like at least more than an hour before the next person, or 2 to 3 hours before the next team comes in. If we, that's the recommendation. But I can't give you a hard and fast rule. After 2 hours, your room will be green. Ideally, everyone, whoever was in your bedroom, should have been wearing my mask as well, which will reduce the risk.
Thank you. Auntie Mutsa, you want to add?
Yeah, I was just going to say exactly what Dr. Shingai said. Kuti nyaya iripo ndeyekungoti vana mukoma vanouya kuzogadzira magetsi nezvimwe zvakadaro, ngati make sure kuti vane mamask avakapfeka. In the event yokuti vasvika vakapfeka mask yatinofunga isu vagari vepamba kuti it's inappropriate, for example ine tumaburi kana kuti yakasviba, kungovapawo mask yekuti hamukoma chimbobatai nepapa, movhara muromo, movhara nemhino pamunenge muchishanda pano, zvinobetsera. But we safeguard the safety of our households and our families as well. Thank you.
Thank you so much for that. In the context of disinfection still, what is your comment on our groceries and vegetables? Do they also need clean, sanitize, disinfect? Anyone from the team to comment? Groceries and vegetables. Do they also need clean, sanitize, disinfect? Anyone from the team? As we think about that one, I'll just read a comment. The university has been testing the concentration of the disinfectants, and we have found that there are some bad people out there exporting this disinfection. Please make sure the concentrations are correct. You can even take the same to movement analysts. Uncle Jeff, you're on the line. Please just clarify. I think I read something wrong there.
So what is happening is their companies just appeared during this period. So Panama claims of which this concentration, alcohol is 65%. That is the recommendations that are required for whatever, where they talk about my disinfectants and all sorts of things. So what people need to note is that there are people out there who have bad intentions, who are just wanting to exploit the situation. Well, I mean, I know at one point the claim was there's 65% alcohol. When the chemist at university tested it, it was just 22%. So people need to be careful that you are using the right concentration. So you can actually take it to my university. I know government analyst also does one tester. You can take to the correct labs that can check it for you. That is this correct? If it's not coming from a reputable, Standard Association of Zimbabwe, you need to double check that you have the correct thing.
Or in short, you're saying we should buy from reputable sources?
No, I'm not saying that. If you are buying from someone else, still make sure that the concentration they are saying is the correct one.
Thank you, Uncle Jeff. I don't know if there's any comment about the groceries and vegetables from the team. Auntie Mutsa?
Yes, so nyaya yemiriwo nezvimwe zvatinotenga kumashops, one of the things I've noticed even before COVID-19 came is, you know how tinomira pamiriwo paya and you want to take the firmest green paper kuitira kuti inyatsogarawo mufriji, hausi kuda yakasvava. Saka tinoona kuti there's a lot of handling of those vegetables, even in normal situations, without even thinking of COVID-19. And I think it's just good practice kuti when we get home, kungozviisawo sink, if you want to put in some jik, if you want to put in whatever, zvinoita kuti at least ngazvipinde mvura, ngazvicheneswe. And then by the time we put in the fridge, we have washed all our vegetables, and if we are going to be doing cabbage, we peel the leaves and we wash. If it's going to be lettuce, exactly the same thing. The same applies kune, you know, you buy packet safe or packet whatever, washing powder or anything. Many of those things zvinenge dust kunze. And again, someone could have been sneezing, someone could have been doing stuff with their nose and whatever, and then wobata. Iwozotorawo. I don't think it does us any harm kuti kana zvangosvika kwakungoita kapractice kekungoti ka 0.1% kedu kaya karipi, put it on a cloth and then just clean those packets. Plus zvimwe zvachona, it's also about peace of mind. You know, some of these things are not hard and fast, but in your mind you just think, you know what, this is what is happening in normal life. Why not just clean? And if we start that sort of thing, and our kids at home, if there are children at home, they get into the habit, guys, before we eat anything, let's make sure that we have cleaned, let's make sure that we have washed our hands, let's wipe down our plastics, let's do this. You'll find that when they are now alone, they will continue that habit. They will not just go to kakona, kashop, kepa kona, kanot patak shop, and they go and buy something and start eating, because we'll have started that practice at home. Thank you.
Thank you, Auntie Mutsa. A comment, maybe now more comments are coming in on the treatment of COVID-19. What about the alkalinity of fruits? More than 8 will prevent COVID. Is it true? Dr. Chimbetete.
I think the simple answer is it's not true.
Sorry, you may repeat yourself.
I said, I think the simple answer is it's not true. We do not have evidence to say that high alkaline fruits will protect us from COVID. Remember how COVID is acquired? Through the mucosal linings, mukama, mino, maziso. If you take alkaline fruit, where is it going? It's going into your tummy, into your stomach. So I don't see the link there.
Thanks, Doc. How is our Zim weather advantageous to us, if any?
I think initially that's what people thought, since Africa kuchipisa, we will not have COVID. But I think we do not have evidence to make us think because we have a hotter climate, we will not have the pandemic. I think it's already showing. So atina advantage yatia provika anyway daebi. So let's keep safe. Let's practice social distancing. Let's wear masks.
If I can add, any advantage that we could infer is if if you still have to meet people, or you are still, for whatever reason, being forced to have one-on-one meetings, it is better if they take place outside, because then you've got the ventilation, the air is blowing, you can, sit far apart enough. And it is a fact in that UV light does have a degrading effect, pane virus. Saka chances are my tables or my surfaces are shandisa kana aswera mzua. The virus is more likely to be weaker, if I can put it that way. So that if disinfection is not taking place better, at least mune advantage in sunshine, your ventilation is better. You can sit further apart, and which then minimizes risk. I guess the only advantage is people should actually take advantage of the weather and get outside if they have to meet people whose status they don't know, who are not of their household. So whatever can be moved outside should be moved outside, but people still insist. I see us still meeting indoors, etc., etc. But ndoega potential advantage ashinayo. But in terms of just because the weather is warm, corona HIT, as long as you are not physically distancing, not washing your hands, not wearing a mask, sun or no sun, inongo spread. Over.
Thanks, Doc. Let's kindly mute our masks if we are not contributing to the discussion. Thank you. My mother has been on hydroxychloroquine for arthritis for more than 3 years. Why are doctors in Africa not pursuing this?
I think I put a message on the chat. I don't know if you can read it out.
Your response. Sorry. Hydroxychloroquine is licensed for arthritis and other immune diseases. COVID is a viral infection, and studies have found no benefit of chloroquine or hydroxychloroquine. The disease processes are different. Yeah, I like that response. And Dr. Chimbetete, maybe you want to add on?
No, I think the response is very clear. The fact that a medicine works for something doesn't mean it works for something else. So because studies have been done and they've already shown that it's not useful, there's no need for African doctors to focus on it because my results are reported.
I'm thinking a flip side of this question is, since someone has been using it safely for the past 3 years, why are we then talking about toxicity, potential toxicity, Doc? Maybe
I think
that's
remember
another question.
Remember, it's about toxicity versus benefits.
Yeah.
So this person has been using it for a condition chloroquine works. So it means that the benefits outweigh the risks. So now to use it for a condition it does not work, it means the risks far outweigh the benefits.
Yeah. Thank you.
And also the doses we're talking about. Every medicine, even water becomes toxic if you overdose on, even water, becomes toxic if you overdose on water. So the dose is also something. When you're talking COVID, my doses are arthritis.
For anasalbutamol, flomist, prednisolone, tinoshandisa pa asthma iri mumhuri medu, anobatsira here to suppress the symptoms.
I think matotaura mega kuti tiri kuashandisa for asthma. It means kuti you are using it for a particular condition. There is no one size fits all where medicines are concerned. That is why pachiitwa research inofanira kuprovida umbo wekuti a particular drug or a particular medicine inoshanda zvakadii, inoshanda sei on a particular condition. Hazvingonzi munhu ari kunzwa muviri wese ngatingomupai chakati tozongoona kuti hamina apona kana chashandawo apa kana chashanda apa. So I think zvinoda kutipa ka false sense of security. Kekuti, because takambonzwa dexamethasone and it's a steroid, prednisolone is also a steroid. Very different things. And it's the scariest thing is sometimes when we take these chats on WhatsApp groups and so on from people who are informed who are not quite informed by evidence, and then we take them and begin to apply them to ourselves, they can end up causing more harm. Imwe tsika iri kuitika ndeyekuti ini wangu akadai so akashandisa ichi zvikamufambira, but uyo wako uyo neuyu newe hamuna kufanana, zvimwe zvinhu zvamakatakurana nazvo zvakatosiyana. Maybe iwewe you've got a pre-existing heart condition which you have never known. Yekuti ukarova hydroxychloroquine iyoyo uri kumba, your heart will just say kuti that rhythm yawambenge unayo, which you have never known actually. One wazotora hydroxychloroquine and you find kuti you now react to it or it actually causes more complications. So I think let's be very careful about, that's why mamwe achinzi prescription drugs. prescription drugs are given that name because they ought to be prescribed by someone who is informed about their use. Yes, there is issues of off-label use of drugs, but then even if it is off-label use of drugs, they are not given by community and family members. They are not the prescribers of those medicines. They still need to be prescribed by a qualified medical practitioner or a medical person who is able to take everything into consideration, including the risks that can happen, including knowing kuti baseline function yako yemoyo yako yakaita sei, baseline function yemakidneys ako yakaita sei, sugar yako yakamira sei, iwewe nemushonga uyu munoenderana here. So Dr. Chimbetete might be able to take a certain drug for BP, but ikazoya kuneni, pamwe it will not work because of individual differences. So it's really important that, yes, we get this knowledge, but when it comes to medicines and prescribing medicines, I think it would be good for us to defer to those who are informed about how they should be used. Over.
Thank you, Auntie Muta. Another question, is it advisable for one to start taking vitamins or zinc in a suspected or confirmed COVID scenario? I know, Shingi, you answered that, but maybe you want to say that out loud.
Oh, okay. I was going to say, as Dr. Chimbetete said, hapana treatment, and probably I'll just use the same this opportunity to answer. I think someone else, Enoch, was asking about someone, they know someone who recovered without any treatment. So as he mentioned before, the vast majority, up to 80% or more of patients will get mild or no symptoms. And even if they did nothing, just like you do with the flu, they will recover. So that is why there are so many supposed cures on the internet, because those people were going to recover anyway. So taking vitamins, taking zinc will not hurt, provided you don't overdose. Because even vitamins now, like I mentioned before, example yemvura, if you overdose on even the mildest thing, it can now bring in an element of side effects. Zinc, some intestinal issues, even vitamin D overdose can cause you problems. Even vitamin C overdose can cause you problems. So if you can my vitamins, take them as prescribed on the bottle. If they said to, don't now say no, you have COVID, 10 a day, because then you cause yourself some new problems that you were going to avoid. So they don't do any harm, provided you take them at prescribed levels.
Thanks. I think Dr. Chimbetete touched on this one. Also, there is an issue that for serious cases, patients may need oxygen. It appears that our hospitals may not have this. Is it possible to purchase our own oxygen and self-medicate? Is it possible to get the oxygen privately? Dr. Chimbetete, maybe you want to reiterate.
Oh yes, I think there's a company known as Utano. Dr. Wazara knows this company well, who are actually providing home cylinders, and they'll show you how to use the oxygen, and you can administer at home. So it's possible. But what's also very key is that have a health worker who continuously checks on you, because ultimately, remember, you're not medically qualified. So it's possible to take oxygen at home, but have somebody to monitor you. I think that's how I would answer.
So would you advise someone to just think, I've got shortness of breath, I need an oxygen cylinder, off to Utano? I think that's part of the question. Can I self-medicate oxygen?
Remember what I emphasized, Kuti, before COVID came, vanhu vaizarirwa. After COVID, vanhu vacharamba vachizarirwa. Saka kuzarirwa is not equal to oxygen. Unokwanisa kuzarirwa because wapinda asthmatic attack, unokwanisa kuzarirwa because you've got the bacterial pneumonia, unokwanisa kuzarirwa because your heart is failing. So you need a qualified somebody to tell you kuti nemhaka yei uri kuzarirwa. And oxygen, remember, haisikurapa kuzarirwa iri kusupplementa oxygen. Saka kana une pneumonia iri bacterial, the oxygen is not going to treat the pneumonia. So the pneumonia needs to be treated. Kana une heart failure, the oxygen is not going to treat the heart failure. The heart failure needs to be treated. So this is why you need to see a qualified medic or somebody, and then you can then get oxygen at home, which you monitor.
Just to also say, kuti pa oxygen, especially like Dr. Chimbetete is saying, it needs you, a qualified someone, to show you how to use it, because it's obviously bottled under pressure. And if that is not managed properly and you get oxygen under high pressure into your lungs, it would be like popping a balloon. And then your lungs will pop off, and then you get air, and that's another something which we don't even want to be getting there. So again, oxygen is actually a drug. So let it again be prescribed, and use it under the correct conditions and support from people who are qualified or who are trained to use it.
Thank you. I don't know, Dr. Chimbetete, if you address the issue of steaming kunatira. Someone in my inbox is asking if you can further talk about that. Is it effective? Is it recommended? Is it necessary?
I don't think I'm the best person to answer that. Maybe Shingi, what's your experience with that?
Yeah.
My experience is zero, but I'm hearing it's quite a popular thing with steaming. So for me, I put it again under one of those, okay, we have a principle in medicine, you know, the first do no harm. And it now depends on how the steaming is being done. Because so unfortunately, I came in late. I didn't hear all of what Dr. Chimbetete said, but I'm sure he explained that by the time you're getting symptoms, the virus has entered your cells and has become part of your cells, and not just the one layer of cells that's lining your nose and your throat. That's the difficulty with viruses. I don't incorporate, they become part of you. That's why you can't kill them, because you have to kill yourself first. So this issue of steaming, I guess if you are doing it correctly, for me, I would use those humidifiers, where you put in a bit of vapor, whatever, just to humidify the air. Like asthma patients know this. Humidify the air as opposed to steaming. This is if you are having difficulty breathing. Again, Ingor is something to make you feel better. It's not going to treat. You still need to be monitoring your temperature and your saturations if you can get that little pulse oximeter. Because problem, COVID, sometimes but actually your lungs are extremely damaged. Then shika that point of there'll be a dramatic deterioration, and from but in 1 hour someone can become breathless to the point of so all of these things can be done, but they must be done with some kind of healthcare monitoring going on. Your respiratory rate a bit too much. I think any minute you can get tired, start going early, because the earlier you get proper intervention, the better. A lot of people, they are coming in very late. They're spending time at steamer, vachitora zinc, vachitora chi. Then by the time all their remedies, that's when they're coming off. But unfortunately, pan is a steep and a sudden deterioration in which can corona. Sometimes even ventilation because your lungs are too far gone. So to say whatever you want to do it, but don't leave it too late. I hope that answers the question.
Thanks, Dr. Shingi. Dr. Mchedzi, you want to say something? Hi, Dr. Mchedzi. Okay, I guess he left his comment in the chats where he said steaming may just help in thinning the mucus clog and help secretions come out. I'll mark the word may just help. So what Dr. Shingi still stands to say, don't wait until it's too late and rely on steaming whilst at home. Then someone is asking about which hospitals are currently taking in COVID-19 patients, as many people are being turned away. Can someone speak into that? Dr. Shingi, I'll come back to you. You are right in the field.
So as we all know, there have been staff challenges, but right now PARI is admitting when they have space. I think problem PARI, there was the issues of unfortunately, but sadly, sometimes my overzealous guards that were preventing people without even alerting the medical team inside someone needs assessment. So PARI, I think Wilkins should have reopened. Pangwambo close a bit. Health Point, which is a private facility, and St. Anne's should be opening soon as well, which will there'll be some kind of fee. But so do admit that I know for now in Harare. Bulawayo, UBH, Mater Dei, and then in most provinces, it's the provincial hospitals.
And also the district hospitals as well.
Yeah, the district hospitals should be having some isolation, a few isolation beds as well. It's in the oxygen.
Thank you. Another comment from previous training, we were advised that it is not best to put on gloves if you're serving others. I noticed that most toll gate personnel will be putting on gloves. Is there anything that can be done to educate them and protect other citizens? I think we are seeing this even in the banks as well. Maybe for me, what I appreciate is the banker or the toll gate personnel is protecting themselves since they are handling money. The problem for them would then come in if after handling money and spending the day with that glove, they start touching their face and things like that, then they are at risk. But we must appreciate that whatever has been touched with the glove, consider it unclean in quotes. It means you must then observe hygiene. Dr. Chimbetete, you want to say something?
No, sorry, I agree with what you've just said. We may not be able to stop them, but it's also let's protect ourselves. I wanted to make a comment, Panesha Taurwa and Dr. Shingi, about the various government institutions. I know, especially when we're Harare, sometimes we think everything government is bad. So I just wanted to make a comment. You know what? People have been admitted to PARI with severe COVID, and people have gone home alive and well. So let's not ngatisatye kuenda kuparinyatwa kana kuma-government. You are better off at a government hospital than at home. There's this thinking about everything government is bad. People are being helped and lives are being saved at government institutions. It's way, way better than being alone at home without monitoring. That's what I wanted to say.
Thanks, Doc. Someone is asking if there are any contact details for the Faith Ministries Medical Missions team. I think, as was rightfully said before, if someone develops symptoms, there are the toll-free numbers which you phone for free yakanzi 2019 neyakanzi 2023. They will assist you kuti moita sei. They will recommend what you should do. Should you go for testing or what? In addition to that, we as Faith Ministries Medical Missions have availed ourselves to assist members and the communities in which our churches are. We have circulated our numbers through your church pastors. So please ask your pastor for any contact you might require so that we can assist you in any way possible. Someone's just saying, thank you, Dr. Chimbetete, for your comment on government hospitals. Without further ado, I think we are done with questions in our chat box. Thanks to all the presenters this week. I'll hand over to Dr. Magumise for closing remarks.
Let me show you.
Let's remember to mute our mics now if we are no longer contributing to the discussion.
So, Dr. Amson, can I just make one last comment before? I don't know if anyone talked about the proning.
Please.
No, we haven't talked about it.
Okay. I'm sure people have seen a video of a doctor on their hands and knees, taking deep breaths. If you are diagnosed, that those at least are some useful techniques. If you either lie on your stomach or on your hands and knees with your head down and take deep breaths, at least for an hour or so. It helps to recruit my lung units and helps to ventilate the rest of your lungs. Over.
Thank you.
Thank you very much. Thank you very much, Dr. Churinke, for that. I think as we end up our training, I just want to extend my gratitude to all the people that have participated. I think we did well. Our numbers, I think we're doing good. I think on a daily basis, we are almost averaging more than 70, close to 80, which is good. The main aim, obviously, was to, as the Faith Ministries Medical Missions, is to disseminate information as much as we can pertaining to this COVID-19 pandemic. So we hope that what has been shared has been useful to you all who have participated. But we also did this so that you can also help the communities that you interact with, the churches where you belong, so that you can also help them with the information that we have shared as Faith Ministries Medical Missions. In the event that you need any clarification or any help to the issues that we have discussed, you can always raise the team members that were participating in this training. You are welcome. I also want to extend a deep appreciation and gratitude to the team members that have facilitated in this training session. Dr. Yokai for coordinating this whole training program. All the presenters, which I shall not mention by name, lest I leave out some. But we also know that there are others that didn't necessarily do presentations, but that they actually contributed a lot to this. Some were also contributing in terms of answering questions. I would really want to thank the team for coming together and making this work. So what the team did was to compile what they can and what they also felt was going to be useful to us. But let me add that it might not have been exhaustive, but we believe that we touched what could have been very pertinent during this time and concerning us. So please take what you have learned. Most of this material is available on Facebook, so you can go through it. For those that didn't go through all the sessions, you can actually visit our website and also go through all the sessions and continue to equip yourselves. In the